Hi, my name is Tom McPeek. Want to welcome everybody today for our panel presentation on DM2. We have three panelists today. We'll be starting with Elyse Posner, and then we will go down to Lorrie Gallagher, and we will end with Erica Cho. So without further ado, I want to turn it over to them.
Thank you, Tom. Hi, I'm Elyse Posner, and I want to thank everyone for being here today, either in person or virtually. My diagnostic journey began about 6.5 years ago. I was experiencing symptoms such as difficulty walking up steps. My legs felt weak and my balance was off. I didn't think too much of that since I had been exercising a lot and thought maybe I was just overdoing it. After about a month or so of those symptoms, I then noticed my arms were weak. For example, when I held them out to my side, like shoulder height, my arms felt really heavy. And that's when I thought there was really something wrong. I made an appointment with my primary care physician and told her my symptoms. She ordered a slew of tests, a brain scan, a spinal scan, and blood work, just to name a few. Thank God everything came back, quote unquote, normal, except with the exception of my muscle enzyme level, which was elevated. She then referred me to a neurologist since this was not her area of expertise. Since my daughter had used this neurologist to treat undiagnosed Lyme's disease, and my mom was using this neurologist for her dementia care, I was able to get an appointment fairly quickly. My husband accompanied me to this appointment. After explaining my symptoms, he said it might be polymyositis, which is generalized muscle inflammation, whereby I would need to be on steroids for the rest of my life. He said the only way to be sure was to do an EMG, which we'll schedule at a later appointment. I asked if there was any way he could do the EMG that same day, and he was really nice about it. And he actually did the EMG that same day. Needless to say, my EMG was completely abnormal. Again, he said it could be my polymyositis, or since my mom had frontotemporal dementia, it could be ALS. He proceeded to say there was a link between frontotemporal dementia and ALS in offspring. The only way to tell was to do a muscle biopsy, and the only place he trusted to do the muscle biopsy was Johns Hopkins Hospital. He said they would contact me, but their office was closed between Christmas and New Year's, and I had gone to this to the neurologist just before Christmas. I was convinced I had ALS. I considered ALS a death sentence. After what seemed an eternity, I did finally receive a call from the scheduling person at Hopkins. She told me muscle biopsies were only performed on the second and fourth Monday of each month. The second Monday was already booked, so I made my appointment for the fourth Monday of the month, but I asked to be put on a wait list if a cancellation occurred. As luck would have it, someone did cancel, and I was able to take that appointment. These few weeks were very grim for both Alan and me. I was crying often. I didn't have much of an appetite, didn't want to go out, didn't want to talk to people. We kept looking online at symptoms of ALS, and so many of my symptoms mimicked those of ALS. Our younger daughter was living with us at the time, and we didn't want to let her know, or my older daughter, for that matter, that anything was wrong, so as not to worry them. So many times I would actually have to leave the house because I had been crying and I knew she'd be coming home from work at a certain time. So I would have to leave the house just to try to compose myself and get myself, back together again. So when it came time for the muscle biopsy, the doctor who performed the biopsy asked me a multitude of questions about my childhood and my athletic ability. I told him I never had upper body strength, and I was one of, or the last person to be picked on for various teams in elementary school. After he performed the biopsy, he came in and spoke to me, saying he wouldn't know the diagnosis for a week or two until after fully testing it. I was discharged and told to rest and not put pressure on my leg for a couple of days. The doctor who performed the muscle biopsy actually called me later that day, or later that evening, to see how I was doing. He had done some preliminary testing of my muscle sample and said it didn't look like ALS. He told me the way I presented, and from what I said earlier that day, prior to and during the muscle biopsy, he thought it was classic ALS. I was a little more relaxed at that point after he told me that it wasn't, or he didn't believe it was ALS, but I still couldn't be too sure. By the end of the week, I did get a call from my neurologist, who said he had gotten the preliminary results from the biopsy and told me that it wasn't ALS, that it was a muscle disease, but because he didn't want me to worry all weekend, thinking that it was still ALS. The following Monday, I had an appointment with my neurologist, and he went over the results and said it was either myotonic dystrophy type 1 or myotonic dystrophy type 2. Since there was no family history of this disease on either side of my family, I had to go for genetic testing, which took several weeks to schedule. A traveling phlebotomist came to my house and drew my blood. They tested for both types, and I finally found out it was DM2. I saw a genetic counselor at Johns Hopkins who went over everything with me. She asked extensive family history questions to try to determine which parent I got this from. Since we didn't know of anyone on either side of my family, she recommended telling both sides of my family about it. So I told my brothers my final diagnosis, our adult daughters, and my first cousins on my dad's side. But I have 3 first cousins on my mom's side, all siblings, and 2 of them I didn't have any contact information for. The cousin I had a relationship with on my mom's side, her husband was going through cancer treatment, and he was very ill at the time. So I didn't want to reach out to her. I chose not to reach out to her to burden her. I felt she had enough on her plate already. To date, my brothers haven't gotten tested, but my younger brother had cataracts at age 53, and my older brother does have diabetes. Neither of them have any other symptoms to my knowledge. My daughters, both in their 20s at the time, decided they wanted to go for genetic testing. They each did so. Thank God, a million times over. they each tested negative. After about 7 or 8 months post-diagnosis, my cousin on my mom's side that I did have a relationship with sent an email to me asking if I knew of anyone in my family who had muscle weakness and trouble walking up the steps. And I reached out to her and told her that I did. And she was actually asking for her sister, on behalf of her sister. So of course that answered which side it came from. My mom was still living at the time, but our shared neurologist didn't see the need to put her through any testing to verify. My mom definitely had a lot of unexplained leg pain and a whole host of GI issues. From the time I had my initial appointment with my primary care physician to receiving my DM2 diagnosis, it was about 3.5 months, but I knew sooner, probably after 2 to 2.5 months, that it was a progressive muscle disease. All in all, it was a relatively quick diagnosis, all things considered. Living with DM2 definitely has its challenges. I see a plethora of doctors to treat the multi-symptoms I have associated with DM2. My symptoms include GI issues, muscle weakness, elevated A1C level, heart issues, memory issues, sleep issues, fatigue, hearing, and vision problems. As many of us facing this disease, we have to educate our doctors about the disease, since still most doctors have never even heard of it. I have to be my own advocate. For example, several years ago, I had surgery and was very worried about undergoing anesthesia. I spoke to the surgeon and asked if I could also speak to the anesthesiologist. I explained my diagnosis and sent over the anesthesia guidelines, and the anesthesiologist decided to keep me in ICU overnight to monitor me closely. I felt much better knowing that I'd be monitored. When I had a colonoscopy recently, I wound up having the colonoscopy performed in a hospital setting as opposed to a surgery center, because the surgery center didn't have the ability to intubate if necessary. These are just a couple of examples of how being your own advocate can help prevent known complications. I encourage all of us living with this disease to advocate for ourselves. I am now seeing a physical therapist to help maintain the strength I do have. And I have also seen an occupational therapist since I have trouble opening jars, cans, and my grip strength is weak. I do exercise regularly, about 5 to 6 times a week on average, and love swimming and walking outdoors. Not only is it good for me physically, but also for my mental health. I also participate in the monthly DM2 support group, which I find very helpful and look forward to. And I just started participating in the new DM2 support group on the first Thursday of each month. It's great that we're meeting twice a month now. In addition, I participate in the Healthy Living program on a monthly basis that the Myotonic Dystrophy Foundation provides for its members, which I've also found to be helpful. The more we learn about the disease, the better we can advocate for ourselves. My A1C level has been in the pre-diabetic range for a number of years. Last September, my A1C level went up to an uncomfortable level, still within the pre-diabetic range, but closer to the diabetic range. I tried eating less sweets. I do love my chocolate, And then I reached out to my primary care physician asking for a referral to a nutritionist. I didn't think I was doing enough on my own and thought I'd benefit from seeing a nutritionist. I try to stay on top of my medical issues. It's not always easy when you feel like all you do is see different doctors, but it's very important to listen to our bodies and take the necessary steps to address our symptoms. I've gone for a hearing test and I do have hearing loss. The audiologist said it was up to me as to whether I wanted to do anything about it. She wanted me to get rechecked in a year, which I have yet to do. At 63, I'm just not ready for hearing aids. I also have trouble seeing at night. Thank goodness for the flashlight on my phone, on my cell phone, which I rely on often. And when I'm with my husband, he'll also guide me if we're walking where it's dark. Since I have trouble carrying things upstairs like laundry, my husband usually takes care of that for me. He will also bring the groceries in the house since we have a couple of steps from the garage to our mudroom. In addition, I have trouble opening medications, especially those with the childproof lids. And I try to use the grip discs, but often to no avail. So I'll ask my husband to open them for me. Thank God he doesn't mind helping me when needed. I can't stress enough how important it is to be your own advocate and push for certain things. I find myself going to multiple specialists, but that's all part of treating this disease. It's also so important to educate our doctors and give them the quick guide to DM2, so they have that to refer to in addition to the anesthesia guidelines. I am very thankful I wasn't diagnosed with ALS, which in my mind was a death sentence. When I found out I didn't have ALS, I started to cry out of sheer joy. I told my family and friends I will do whatever it takes to live my best life. I have begun to travel a little bit, which is something my husband and I had planned to do once he retired at the age of 58. We want to travel while I'm still able. Of course, the pandemic put a halt to that, but we're hoping to get back in the swing of things. I encourage each of you to try to put a positive light on the disease. Don't let the disease define who you are. Think about what you can do. Don't focus on what you can't do. You are the same person you've always been, but just have various issues. The older I get, the more I realize that everyone has or will have something wrong with them. DM2 can take some of our independence away, but we can still live our best life by making modifications to help us maintain our independence. And I want to leave you with a quote that really resonates with me. Self-pity is our own worst enemy, and if we yield to it, we can never do anything wise in this world. Courtesy of Helen Keller. Thank you.
Hi. Thank you for joining us all here, whether physically or virtually. My name is Lorrie Gallagher, and I'm 70 years old. I was diagnosed with myotonic dystrophy type 2 about 5 years ago, shortly after my brother was diagnosed. My diagnosis came as a strong relief as I was experiencing strange muscle pain and weakness. How my brother got diagnosed is a mystery because my mother was never diagnosed. I benefited from his diagnosis as I didn't have to go through the years of searching for a correct diagnosis that so many of us have to endure. I was even able to get the genetic test and avoid muscle testing. I also was lucky in that I went directly to Stanford and was able to get excellent care, which continues. My first visit was with a team of experts in genealogy, physical therapy, cardiology, and my current neurologist. For my exercise therapy, I do Pilates and stretching. I try to walk, but don't like to. I would like to swim, but I don't have a pool near me. I kayak with the aid of my husband. Once I'm in the boat, I'm good to go. I kayak at the lake near us. I used to kayak on the river, but I got dumped once and couldn't climb up the river's edge to get out of the water. So I stick to an unobstructed surface now. I have been a mushroom hunter for years. I am unable to climb the hills now, so I make do with walking on the edges of roads and catching the occasional mushroom. I'm learning more about insects and birds in lieu of finding mushrooms. Others in the DM2 group have asked me about Pilates, so my instructor provided me with a description. Pilates is a full body movement practice that strengthens and lengthens muscles, promotes joint and spinal mobility while increasing core strength and stability. Pilates exercises can target muscle groups that are responsible for stabilizing the pelvis while walking and build strength and mobility in the feet and ankles. I have had DM2 all my life and have had symptoms that are varied: growing pains, cataracts in my 20s, difficulty climbing stairs, high cholesterol despite a good diet, painful menstruation, swollen ankles. The list goes on. I don't take any pain meds for my DM2, though I have leg pain and balance issues and trouble sleeping. 2 years ago, my cardiologist wanted to check my heart rhythm, though I assured him that I had no heart problems. I received a diagnosis of arrhythmia and later had surgery where an ICD implantable cardioverter defibrillator, similar to a pacemaker, was received. I do use a cane on occasion, certainly on uneven surfaces and when on mass transit. Using a cane in an airport or train is like waving a white flag. People stay out of your orbit. My mother had DM2, but there was no diagnosis available at the time. I realized after my diagnosis that my mind had completely forgotten or excised all memory of her difficulties. I guess that's what most kids do: ignore or suppress memories of other people's problems. Now that I have DM2, I often think about my mother and my impatience with her symptoms and her frustration with a muscle disease that had no name. Going forward, I need to differentiate my muscle and balance problems from general aging issues to know what I can strengthen versus what I'll have to adapt to. In terms of mental health, I need to get out more and keep engaged versus a pull to cocoon and retract from social life. With the aid of the Myotonic Dystrophy Foundation and its support groups and education programs, I feel engaged and accepted. My family members and friends are supportive of my current disabilities. My brother with DM2 has turned inward and rejects all efforts at therapy, and that is his choice. I'm the kind of person who would prefer to educate myself about possible medical scenarios ahead. Thank you.
When I was a little girl, I had big dreams. My dream was to become a Dallas Cowboys cheerleader or a solid gold dancer. And so from the time I was about 6 until I graduated from high school, I was a dancer and a cheerleader. I wasn't the cute petite cheerleader that did the flips in the air. I was the strong one on the bottom that was putting everyone up. I was a varsity and on the Far East Championship team. It's obvious my life didn't quite turn out that way but I hope that this small part of my past gives you an idea of how strong I was and how confident I was. Pardon me, I'm shaking a little bit, not because I'm nervous, but my nerves just don't do too well in this weather, so I apologize. My name is Kahlifa, and I'm currently residing on the East Coast, and I was diagnosed with myotonic dystrophy type 2 in June of 2021, after years of being told that there's nothing wrong with me and that my symptoms are all in my head. It took several years to accurately diagnose or even suspect any type of neuromuscular disorder. And there isn't anyone on either side of my family that has any kind of issues. My family, both sides were professional athletes. So where this came from, we have no idea. I was a career federal law enforcement officer, and I had a work injury in 2012 that required shoulder surgery. Simple enough surgery, we get shoulder surgeries all the time, but my surgery changed my life. I had my first surgery in January of 2013, and about 2 weeks later, I sneezed and felt a large pop, and I never regained full use of my left arm. And after that, I started losing feeling in my neck and shoulders, and I couldn't feel my fingers. I then became unable to use my arm above my elbow. My muscles became atrophic, and I started having unexplained aches on my left side. I slowly began losing sensation and use in other limbs. And having limited use of your arms is difficult enough, but now I couldn't feel my feet, which made it difficult to walk or even drive. Every part of my body hurt. I would get sore and tired from doing basic things, such as grocery shopping or taking a shower. A bath was impossible because I didn't have the strength to get up. And it would take days to recover and have enough strength to try anything else that required any strength or any kind of physical activity. I was eventually misdiagnosed with brachial neuritis, and I was told that everything would resolve within a couple of months. Brachial neuritis is a neurological shoulder and arm disorder that babies are born with, but it can also be caused by a traumatic injury. So fast forward several years, it never resolved, but the diagnosis remained the same. They knew it couldn't be brachial neuritis, but didn't know that there were other options that could explain what I was experiencing. I had approximately 15 EMGs. All of them were abnormal and showed insertional activity. But the neurologist told my other doctors that they couldn't explain why I was having any numbness or weakness. And I went through years of being told that there was nothing wrong with me and to get back to work. And some of the doctors even told me that it was all in my head and that I just didn't want to work. But I always question, how in the world can I fake an abnormal EMG? I started working when I was 13, and I left home at 16, so not working wasn't never an option for me. Work was all I knew, and all of a sudden, I couldn't even put on a watch or remember what day it was. So how am I supposed to use a gun or handcuffs? Being out of work and getting no answers or support from the medical professionals contributed to me falling into a depression. Any and every doctor visit ended with me being prescribed some type of new medication. And it got to the point that my entire life was thinking about the physical and mental pain and trying to sleep to keep myself from thinking about it. If sleeping were an Olympic sport, I would be on a gold medal team because I could sleep for 16 hours and still be tired and sleep again for weeks on end. There are many times that I didn't even get out of the bed until I had to use the restroom or to eat. And this went on for about 6 years. I completely blocked out the world. I didn't want to see anyone, and I didn't want anyone to see me. I was so strung out on different prescribed medications that I was a walking zombie. And I remember very little of that time period. I've tried every pain, psychotropic, and stimulant medication on the market. And at my peak, I was taking 26 pills a day. I was a walking zombie. I lost all confidence in patients with the medical professionals because I was convinced their only goal was to pacify me with medication. None of them were interested in getting to the root of my problem. And I felt as if the medication was nothing but a bandage on a wound that had already healed. The only constant reminder that I had was that I was in such a low mental and physical state that I was waiting to die. What did I have to live for? I was in constant pain. I was losing control over my body and my mind. And I spent my entire existence sleeping and going to the pharmacy. So it wasn't until 2019 that I realized that dying probably wasn't going to happen. And I had to make a choice, either to stay miserable or to make some changes in my life and try to live again. So I made the decision to stop most of the medication and regain control of my mind. It was a difficult and a painful process, but I don't regret it. Living a full life again required me to restart relationships that I'd cut off. It also meant I had to expose my new self to everyone and deal with the comments and reactions that I wasn't prepared for. And I wasn't prepared for how many people would feel sorry for me and how others decided they had to help me in pretty much everything that I did. And that messed up my psyche because I didn't want any pity. And they were doing things for me that I could still do on my own. I also had to get used to people thinking that I was a hypochondriac. So many of us are used to visual disabilities and are quick to judge when someone appears to be fine or normal. And I can't tell you how many times the people the closest to me blew off my complaints over the years. And that hurt more than the doctors not believing me. I recall a time my mother was watching me struggle cut a steak. She leaned over and cut it for me. And the next time we had steak, it was already cut. And me being the youngest, I was the one that always had to do the dishes. It was my job to wash them, and now I've been replaced and told not to worry about it. I wasn't sure how to react. I guess I was grateful that they wanted to help, but it bothered me because I needed to prove to myself that I could still do these things and be independent and that I could manage. So I wanted to cut my own steak and wash the dishes. I didn't want anyone to do things for me and get used to it because I made it this far and I was doing just fine. So most of the people understood and backed off. It was a matter of personal pride. My morale had already taken a beating, and this wasn't something I wanted to have to deal with. I was eventually medically retired and put on disability. I managed to get disability and retirement because of the mental trauma caused by my law enforcement background. I was a hostage negotiator for several years, and I was also in a bunch of different elite groups, that type of thing. So I was very mentally and physically strong. But my medical condition wasn't a huge factor in winning my case because I still had no solid diagnosis, aside from the brachial neuritis that we knew I didn't have. They eventually stopped my disability, and I had to fight to get it reinstated. It was then that I discovered how unorganized and dysfunctional the Social Security Administration is. They closed my file without even getting any reports from my doctors. Their decision was based solely on the doctors they'd sent me to. And I had to involve the congressman to put in an inquiry and get it fixed. Attorneys aren't interested in these types of cases because there's no tangible incentive to look forward to. If you are applying for the first time, they have all this money that they can get their hands on, but if they take it away from you, there's no guarantee that they're going to get paid. So they want to be paid up front. So I had a hate relationship with medical professionals at this point. And luckily for me, my pain doctor convinced me to see a new neurologist, and he referred me to Duke University Hospital after finding out I just had double cataract surgery. He told me that my EMG was outside his scope of expertise, but that Duke would be able to know would know what to do because they had an entire section dedicated to neuromuscular diseases, and they could explain my EMG better than anyone. It took almost a year to get into Duke, but they performed an EMG on the first visit. And during that EMG, the doctor asked me if I would allow her to bring in some of the students and colleagues so that they could see this, because they probably never see anything like this again in their careers. The next thing you know, I was in a room packed full of students and doctors. Some of them seemed familiar with what they were seeing, but the department head told me that what I was experiencing wasn't in my head and that she believed me. That in itself was refreshing because I was hopeful for the first time. They initially ruled out myotonic dystrophy until I told them I had double cataract surgery. And after going back and forth, they decided to test me for DM1. One of the doctors was convinced that I had adult onset DM1, while the others were not so convinced, but they decided to test me anyway. And after about a year of taking the genetic test, the results finally came in. They called me into the dystrophy clinic and gathered around me, seemingly disappointed, and said, "You do not have myotonic dystrophy type 1. But you do have Pompe disease and a few other things." It wasn't until several months later that they decided to send me to a geneticist, who in turn recommended that they test me for type 2. And she explained to me that DM patients are generally of Scandinavian or German origin. And needless to say, Scandinavian and German are probably not the first things that come to mind when you see me. So I finally got diagnosed in June of 2021 after about 8.5 years of being told that I was crazy and that what I was feeling didn't make any scientific sense. Finally, getting a diagnosis was a huge relief because I no longer doubted myself or needed to convince myself that my symptoms and complaints were legitimate. I must admit that I quite enjoyed confronting some of the doctors with the news and seeing their reactions as they read the genetic report. I even had one apologize to me. Overall, I was thrilled to have a name for the things that I felt over the years that pretty much messed up my whole life. I was ecstatic, despite being told that there was no treatment or prevention for the condition itself, but that perhaps they could treat me with some things to try to help my symptoms a little bit more better. We quickly realized that the medications they used to treat certain symptoms would not be an option for me because of my drug allergies. And the only thing they've been treating me for to this day has been pain. I had all the classic symptoms for myotonic dystrophy, aside from the early muscle weakness as a child, because I told you I was super strong. But I had Crohn's disease. I had the polycystic ovarian syndrome, a bunch of various common symptoms that DM patients have. And I'm hoping that medical professionals can use my experience to hopefully test more people for DM so that even more individuals get the help that they need and stop using the perceived ethnic backgrounds as a basis on whether to test or not. Many of you may be curious about what my symptoms are and how I'm managing with DM2. That's difficult to answer because each day is different. I have good days, and then there are days I can barely get anything done. One thing is definite. I always have some sort of pain, but how bad it is usually depends on what I did the day before and how the weather is. Pain medication doesn't eliminate the pain, but it helps take the edge off enough for me to function. And I learned very quickly that pain medication doesn't always help and that taking more of it does more bad than good. I've also realized that stress can exacerbate the pain and prolong the relief process. I know now that common ailments such as a cold or allergies can take longer to recover from. Those common things are also contributing to the pain level because coughing and sneezing are painful movements that make me hurt more than usual. Even laughing too hard can take days to recover from. Did you ever fall and find it too hard to get up? I have, and I still have to take my time or hold on to the side of a chair or a bench so that I can get up without hurting myself or my pride. As far as strength and mobility, that also depends on what I did the day before. I can generally walk without falling, but with no feeling in my right foot, I'm constantly misplacing it and tripping over myself. But I've learned to listen to my body's hints when enough is enough and not to push myself, even if I think I feel good, because I know there will be hell to pay for the next several days or weeks. I've also had to learn how to modify my lifestyle to live more accessibly and comfortably. I may use a rollator and take sitting breaks while shopping or walking, or even use a grabbing device to pick something up that I may have dropped. I hated the thought of using a rollator because I was in the mindset that a rollator was for people who couldn't walk, and that wasn't me. I could walk, but I couldn't feel my foot. So it took me several weeks to even try using it. And then I kicked myself for waiting because it was such an amazing help. I didn't have to rely on my numb foot to guide me. And the rollator would prepare me for bumps and dips, and I wasn't falling down anymore. I also didn't have to look for a tree or a wall to lean on when I got tired. Gripping and grabbing are two of my biggest challenges. I dropped pretty much everything. I started using liquid soap instead of bar soap, and I also put the things I use most at waist level so that they're easier to get to. I put pretty much all of my clothes on hangers instead of trying to fold them. Life is easier this way, and it seems to work. Unnecessary movements equals pain, and I try to avoid it if I can. I had to give up my collection of high heels and strappy sandals and boots because I don't wear anything with streams or any kind of footwear that I can't slide into. Most of my pants have stretch or elastic waists or maybe one button. And almost everything I wear doesn't require ironing. Repetition seems to work for me. Having a routine also seems to help. I'm no longer working because of my physical symptoms initially progressing so quickly. Although my physical progression has slowed down, they're still advanced enough to prevent me from returning to my law enforcement career. The biggest fear is that my cognitive level seems to be on a steady decline. My short-term memory is pretty much gone, and I have to write things down. But on the flip side, I often forget why I wrote it or what I even needed the note for. One of the most helpful and difficult things I had to learn was to ask for help. I've always been independent and self-reliant, but this condition has taught me that I can't do everything alone and that it's okay to ask for help. It doesn't make me less of a person, and it doesn't make me a quitter. Everyone needs help from time to time, and I'm no exception. It took a while to believe and live this way, that I'm no longer afraid to ask for help or accept it. Something else that's worked for me is to tell myself that this is not a disease. I personally prefer to refer to it as a condition or a disorder because the word disease in my mind has a negative connotation. And when I thought of DM as a disease, it always impacted my morale. It also brought fear to my friends and those closest to me, because the worst part of the word disease is that it's implied that I did something to myself or it was my fault or somehow I caught it. I won't ever again refer to DM as a disease, and I encourage you all to consider doing the same to see how it may improve your self-confidence or change your way of life. We didn't catch DM, we were born with it. We're not only just living with it, but we're surviving it and showing the world that it isn't a death sentence. Taking advantage of the resources offered by the Myotonic Dystrophy Foundation have been extremely helpful in understanding my condition and educating the medical professionals treating me. It's been invaluable for me when I'm trying to explain myotonic dystrophy to my friends and family, because Dr. Google makes it sound as if it is a death sentence and that I can't ever live a productive life again. It also made my physicians that are not aware of the condition leery about treating me. But the resources available at the MDF have motivated many of them to learn about the condition. Now, there's still scores of doctors that don't want to have anything to do with me, and I've learned to accept it. The Myotonic Dystrophy Foundation publications have also taught my friends and family that's a progressive condition and that each case is individual, and I may never get to the point that I can't live a productive life. I'm doing my best to live my best life, and I'm no longer worrying about the things I can't do and make best of the things I can. I'm medically retired now, so you may catch me between continents or states. I go wherever the wind takes me, and I make it work no matter where I may be. Thank you.